Hello, my name is Harvey Burnett, and I'm the owner and chief strategist of the Dunamis Insurance and Business Services. And welcome you to this particular presentation on the supplement, what I believe is an exciting supplement to the Medicare Advantage policies. Now, some of you either have parents or know someone who has a Medicare Advantage policy. For those generally under age 65, you generally don't have these type of policies. You either have a full-blown health plan or something to that effect. But many people have a Medicare Advantage policy, and this particular plan works hand in hand with the Medicare Advantage plan that they may have, whether, no matter who offers it. If you're in the state of Illinois, I can supplement your plan, find the gaps or find the holes that are in your plan, and supplement that by filling it with what we call a Advantage Plus program. Okay, so that's the nature of this particular gathering. And we'll start by watching a brief video that talks about the Advantage Plus and why it is an essential portion or an essential part of the Medicare Advantage programs, no matter which company that you may have. So we'll go right into that.
So, you just enrolled for Medicare Advantage health coverage. Great choice. Did you know there is additional coverage you can add to protect you from the out-of-pocket medical expenses you are still responsible for? Help fill any gaps in coverage and strengthen your financial protection with a hospital confinement indemnity insurance policy from Guaranteed Trust Life Insurance Company. Since 2005, GTL's industry-leading hospital indemnity insurance has been helping clients lower or completely eliminate their net out-of-pocket expenses stemming from Medicare Advantage copays and deductibles after a hospitalization event. Coverage is affordable and pays you directly based on your time in the hospital, regardless of any other healthcare coverage you have or where in the U.S. you receive care. Your potential out-of-pocket costs could be for a variety of services, including ambulance trips, outpatient therapy, critical accidents, and more. GTL's hospital indemnity insurance allows you to customize your coverage to help cover these and many others. Let's see a quick example on how it works. Meet Beth. She is 65 years old, and her Medicare Advantage coverage leaves her responsible for a daily hospitalization copay of $300 per day for her first 6 days in the hospital. Knowing she would be responsible for her high copay, her agent helped her customize and apply for a GTL hospital indemnity insurance policy. Beth's new policy provided a restorable 6-day benefit period of $300 per day for less than $25 per month. A few months later, Beth suffered an illness that kept her in the hospital for 6 days. Her GTL hospital indemnity insurance kicked in after the first 6 hours of her stay. Beth received $1,800 directly from GTL for her hospitalization, which she used to completely cover her Medicare Advantage copay. Instead of worrying about how to pay her high copay, Beth could focus on her recovery without a financial setback. You shouldn't have to worry about covering out-of-pocket medical expenses. So now is a great time to think about GTL's hospital indemnity insurance.
All right. That is the hospital indemnity program offered by GTL. Now, many of you are wondering, you said, well, how does this work with the plan that I have? And each individual or each situation is slightly different, but there's a couple of things that I want to look at here. A couple of different plans that I've already pulled up. One is the Blue Cross Blue Shield Medicare Advantage plan, specifically the Blue Cross Blue Shield Advantage Basic HMO plan. That's what we're going to be looking at today. And the other one is a popular plan as well. This is called the AARP. Oh, let's see. Excuse me there. This is called the AARP Medicare Advantage Choice PPO plan. And this is offered through, of course, United Healthcare. So these are pretty popular plans. and the benefits for each plan are slightly different. So what we'll do to start off with is to bring up an accurate comparison. I'll need to log into my system, and we'll begin by letting the system do some thinking for us. And thankfully, my particular system already knows what plans are in whichever area. We're going to pretend that we're in the Peoria, Illinois area, 61604 zip code. This plan is going to, or at least the matrix here, is going to search for all the plans that are available in my particular zip code. As you can see, we've got Aetna, Blue Cross, Health Alliance, Health Partners, Unity Point, Humana, United Healthcare, which is one that we're going to look at, as well as Blue Cross, and also the WellCare plan are in this particular area. The first one we're going to look at is the United Healthcare AARP plan. If we pull that, United Healthcare will let us toggle down to the particular plan that we're looking for, and we're looking for the Medicare Advantage Choice, PPO plan. That looks like it right there. And it's going to bring up exactly what the Choice PPO plan offers and what are the various copays and different things that really concern us, or the gaps that are in that particular plan. And as you can see, that particular AARP plan has a hospital copay of $275 per day for days 1 through 5. So for 5 days, if you have a hospitalization, even though you have the Medicare Advantage plan, you will be responsible to paying $275 for those first 5 days. That is $1,375 out of pocket. Also, for an ambulance, whether you're in network or out of network, you have a $270 copay. So if you have an ambulance and the ambulance ride costs $500 or $1,000, you'll pay $270 of that. For outpatient and rehabilitation services, in network, there's a $20 copay. For occupational therapy visit, $20 copay for physical therapy and speech language therapy, and out of network, $50. So there are $20 copays basically in the network. And for tonight's conversation, or today's conversation, we're really kind of dealing with the in-network copay arrangements. I don't want to draw it out with the out-of-network arrangements, but nevertheless, you have $20 copays. And for skilled nursing facilities, for days 1 through 20, you're not on the hook for anything. But if you're in a skilled nursing facility further than the 20th day, in fact, the 21st day on through the 39th day, you have $188 copay or share. And for that, that's about $3,384. Now, the total out-of-pocket maximum under this particular plan is $3,400 in total. And you can find that, just in case you were wondering. I went over to the Medicare Choice or the Medicare Advantage place, or through AARP, and kind of brought up that particular plan. And I'm able to go through and see my out-of-pocket maximum of $3,400, and that's in the network. Out of network, again, we're not as concerned about tonight. And also, pull up my inpatient copay, skilled nursing facility information, everything I just told you. I was able to pull that up directly from the website themselves, looking directly at the information that the company puts out about its own product. Now, with that said, that's one thing. So we see, what that program offers and what a person that may have that program at a $49 premium, mind you, may have. So these are the recommendations for the plus, for the GTL Plus, Advantage Plus gap filler program, if I can call it that. So these are recommendations. Now, do I have to take all of these recommendations? No, I don't, but I can tailor a plan to really kind of meet or fit the recommendations, okay? Or really kind of fit these recommendations. So I already know I've got a $275 copay for the first 5 days. So the system says, well, let's get $280 to cover that copay for 5 days. Then I've got ambulance service rider of $300 on here, because I know if I call an ambulance from under the particular program, I'm going to be out $275. And also skilled nursing facilities. Well, I don't need anything right up front, because remember, under the AARP program that we're looking at, everything was covered for the first 21 days or for the first 20 days. I only really needed coverage for day 21 and thereafter. So what we do is we have a couple of different options. That's called option 2 in this program, where we can, kind of plug that in. And in this particular case, they're saying $120 for, up to 100 days, but we can adjust that amount, and I'll show you what the adjustments will do as we get into it. One thing that we have in this policy that is not available on the Medicare Advantage policies is a lump sum cancer rider. So if somebody is diagnosed with cancer, this particular plan will pay a lump sum, and we can see the lump sum choices that we have to pay for medications, to pay for rehab, to pay for whatever expense. There's no limitations on what those dollars can be used for. And it has a reoccurrence, so that if somebody has cancer, cancer is either surgically removed or goes into remission. And after a certain time period or frame, that particular benefit reloads itself. It has what's called reoccurrence, reload. So if there's another diagnosis of cancer, whether it's the same cancer or a different cancer, there's another lump sum value available. And also pays additional money for hospital admissions and outpatient surgery. So let's see what the pricing on that would look like for that particular program. And in this particular case, we're going to create a hypothetical person. We're going to create a hypothetical Jones. Okay, so hopefully your name is not Hypothetical Jones, but if it is, you've been immortalized here. So we're going to give Hypothetical Jones a birthday of 1/27/54. Okay, so we're there, and in this particular case, we're assuming Hypothetical Jones is single and in Illinois. So we're not going to add a spouse to this one. So, but there are advantages and various things, various reasons that a premium can be lowered through having a spouse on a comparative basis anyway. So what we're looking to do is quote the Advantage Plus Elite program. And the computer is going to, once we open it, is going to take us through some calculations. First of all, fill in the basic recommendations that it has, but we're going to tailor this plan to make it fit. Now, going by those basic recommendations that we looked at first, the premium or the monthly premium would be $106.18. But like I said, we're going to work on that particular plan. First of all, we're going to leave the benefits the same as they are. We're not going to increase them with inflation or have an inflation protection built-in increase or automatic increase on them. And we're going to start by looking at the hospital copay. We know that on the basic program, there's $275 a day for 5 days. That's the exposure. So the benefit period is 5 days. And let's see if we can get to 275. We can either go 270 or 280. So the system is chosen to go over, and that's 280 benefit. All right, so we got that. Ambulance service will be out $270. We can either go 250 or 300. So the system has chosen to go 300. Again, the overpayment would go to you, but more money would also go to um, go to the bill that's outstanding, therefore reducing any additional out-of-pocket expense or expenditure there. Then there's the outpatient therapy rider. In this particular case, um, uh, the outpatient therapy rider is either two choices. You can go additional outpatient therapy dollars of $50 for 15 days or for 30 days. And of course, we chose the longer plan. The system automatically chooses that. Now, skilled nursing facility, remember, you didn't need anything right up front. So you don't need anything from day 1 to 50. You just need something starting really day 21. And so the skilled nursing facility option is in there. Skilled nursing was $188. This recommends 120, but let's go up to the 180. Okay, the system is going to recalculate itself, and we'll talk about that in a second. Then we go to the 100% the reoccurrence of the cancer rider. We have any lump sum amount from $2,500 all the way up to $20,000 that you can attached to this particular policy. In this case, we've attached $5,000 and we'll leave it there. There's also a critical accident rider that could be placed on the policy that's not being accounted for. Also, there's a hospital copay amount as well for outpatient surgery for a lump sum hospital, and also outpatient surgery. Under this particular plan, it looks like the copay is generally around $250. So we're going to adjust these amounts both for the lump sum hospital rider to $250. It's going to recalculate, and also for the outpatient surgery rider to $250. The dental and vision, we're not going to so much as worry about it. But nevertheless, we'll see that we do have options for the $400, $800, and $1,200 vision and dental riders, just in case your particular program is not adequate enough in those particular areas. Now, with those changes that we made, let's see how that affected the premium. Voila, there we go. The premium seemed to have gone to $80.45 a month, down from the plus $100 a month that we're looking at. And we know that the great majority of that $3,400 out of pocket is going to be covered under this scenario, especially between the initial 5-day stay, which is here at $280 a day, and also any skilled nursing facility care, because this actually covers from day 21 to 100 an additional copay of $180. So this particular plan here really kind of fits the gaps, or meets the gaps that are found in the AARP Medicare Advantage Choice PPO plan, and addresses those gaps quite handsomely, and takes care of that particular occurrence there. So let's go on back, because we want to look at another plan, and it might not let me do that. I might have to reset it. In fact, that's what we'll do. All right. So we're going to take a look at that as compared to the Blue Cross plan. Now, the Blue Cross plan is generally a $0 premium. The one that we're looking at tonight is a $0 premium plan. And so that means that your basic, copay, or what you're paying for that in a monthly premium is $0, of course. So again, we'll put you here in Peoria, Illinois, bringing up the zip code 61604, and we'll identify the plan, Blue Cross and Blue Shield, and we'll toggle on down to the Blue Cross Blue Shield Advantage Basic HMO. That is the middle of the road there. And again, I could pull up either one of these plans, and it's going to show me exactly, what they're doing, what those plan benefits are. But here in the Blue Cross plan, there's a few things, and just in case, I also have the summary of benefits, because I want to check out everything that goes on. So I have the summary of benefits here for the Blue Cross plan, and this is the current one. And I'm able to bring up, all the benefits that this particular plan has, and really all three plans that Blue Cross offers in my area, starting really here at about page 8 on the PDF. And I can see what, deductibles and copays and all that type of stuff that I'm responsible for. But let me go back to the particular information page. Just like the Blue Cross brochure tells me that we have a $225 a day copay for days 1 through 7, and then 0 thereafter. This particular plan page verifies that information and says there's a $225 per day, days 1 through 7 copay that's responsible, that the customer is responsible for, and 0 thereafter. Okay, so that's consistent. We know that we're on the right plan. Basically, that comes up to about $1,500, so $1,575 worth of payments that are due, through this plan. Also, there's an ambulance benefit. I have an ambulance deductible or ambulance copay that would have to be paid of $250. Outpatient rehab, outpatient therapy, and all of that is $35 a day that would have to be paid. And skilled nursing facility, again, for days 1 through 20, there's no copay that you would have to pay. But after that, there's $188 a day that you'd have to pay for days 21 through 100. So if the bill is, $500, you would still be on the hook for 188 of those particular dollars for days 21 through 100. We can identify that comes up to about $14,000 that you would be ultimately responsible for. But thank God there is a maximum out of pocket annually on this program of $29.50. So it is somewhat less than the AARP plan. But nevertheless, we're not judging or comparing those particular plans because either one of them are good plans. But we are looking at how to enhance those plans and how to better supplement them. Remember, our outpatient rider or outpatient copay, they're going to pay for outpatient rehab $35. We've got the Blue Cross or the Guaranteed Trust Life option. Remember, is stuck to about $50 on the outpatient copay arrangement, outpatient therapy. So even though your copay is only $30, this particular plan will pay $50 of that. So there is what's called a benefit overage, and that benefit overage either goes to the bill or comes to you as you instruct. In fact, the whole thing comes to you, and you can actually pay them as you deem fit and or would like to pay. But here we are here, and again, we're hypothetical. Hypothetical Jones. All right. And again, hypothetical is a male here. In fact, let's make this hypothetical Jones this time a female. 127, 54. So hypothetical Jones is a male. I don't know, I want to change her name, but we'll stay away from that. Hypothetical Jones right now is a female. And so let's look at what the cost of a plan would be for her. Again, we'll pick the Advantage Plus, Elite, and we'll let the computer do its thing. And it's going to tell us what the basic pricing will be, and we're going to tailor this plan to really kind of meet. So hypothetical Jones Again, looking at this particular plan and going by the basic recommendations, you see there's a couple of things. And again, we're not adding any cost of living, and not cost of living, but inflationary increase to this particular plan. So it's a basic plan with basic benefits. But there's a few things that we want to do. Number one, we have 7 days in this one as compared to the last one when we had 5 days that we're covering. We're covering 7 days under this one because we know the Blue Cross will cover $225 for those 7 days. And again, we've gone to the higher number, 230, as compared to 225. We know also under the Blue Cross plan that we would have a ambulance benefit of $250 that we'd be responsible for. So we're going to make sure that that's paid. We've already talked about the therapy. We're going to offer $50 worth $50 per day of therapy for 30 days as opposed to 15 days under this particular plan. And the skilled nursing option, of course, we know that upfront is going to be paid. So we don't need that upfront option. We need the secondary option. We need payments from day 21 to day 100. This will be 120. But let's take a look, because Blue Cross actually is going to pay 188 days for skilled nursing. So let's go up to 190. For that, the computer will do its thing there. And also the cancer benefit, again, which is all of these things are optional. Cancer benefit rider is there. We'll leave that at 5,000 with 100% reoccurrence. Critical accident, again, we won't include that there, but we are going to lower down the lump sum hospital riders because there is a hospital copay of $225 for surgery. Let me see, outpatient surgery, 250. We'll lower that down there. And we'll also lower down the lump sum hospital rider as well to $250. And we won't worry about the dental and the vision again, unless we have a problem. Now let's see for Miss Jones, Miss Hypothetical, what that premium adjusted to. And that is $79.95 a month. So she has zero premium on her Medicare Advantage plan, basically. And now she has a $79.95 a month premium to cover or fill the gaps of a plan that she knows in worst case scenario, in any given year, she would have $2,950 worth of, of expenditures out of her pocket. How simple is it to get into this particular plan? Well, once we've determined your needs and once we've tailored the plan to meet your budget and to do whatever is necessary to be done or to cover the things that need to be covered, then we can simply apply directly with the company. In fact, we have that there. We can actually go from there. Once I've determined what's going on, the company will, have me ask you a few different things about additional services that you may like or may want. And then from there, we'll write into the application itself. And we'll get into that and go through the application, collect your payment information and all of that. And you are enrolled and good to go. And that works in conjunction with any plan that you may have out there that's under the Medicare Advantage program or scenario. So once again, you may have parents that have Medicare Advantage or maybe even have Medicare supplements. And if it's Medicare supplements, we have other programs that can really help you out in that area. We have a full range of Medicare supplement companies as well. But this particular one is very unique because this is like one of the few plans out there that actually supplement or fill in the gaps for the Medicare Advantage program. So I want you to, consider the cost saving options and the benefits that you may be able to obtain through this particular program. And you can always call me for a quote. Yeah, that is Harvey Burnett at Dunamis Insurance. In fact, let me go there now. Dunamis Insurance, you can pull up our website, and this website looks like this. Yes, that's right. We stand with all of those healthcare professionals who have helped us through this particular pandemic and crisis. But Dunamis Insurance and Business Services, we're located here in the state of Illinois, and we serve Illinois clients and clientele. Listen, I am Chief Strategist. If you go out to that website, you'll see me. That was a picture a few years ago. But nevertheless, I am Harvey Burnett, and you can reach me by either emailing me, harvey.burnett@dunamisinsurance.com, or giving me a call at 800-730-2990, extension 801, or calling my cell phone directly at 309-648-5351. Listen, you can call for a quote. Quotes are free. We'll be glad to go through information with you and help determine which particular path may be the best path for you or the best supplement that you can obtain. Again, thank you so much for taking the time with me here today. And please share this video with family and friends that may need these type of services or have Medicare Advantage plans, and we'll be glad to help them out with as much kindness and care as we can possibly muster. Thank you once again. God bless you, and you take care.